All right, welcome back. This is the Something Ventured podcast. I'm Kent Lindstrom. I am your host. My guest is Raj Kapoor. How are you doing?
Doing great, thanks.
So this is interesting. Raj has had a varied career. He's been a venture capitalist. That's not that unusual, but he's founded several companies, one of which is SnapFish, and is now the chief strategy officer at Lyft. And I had hoped to have a really interesting conversation with you about the future of mobility, but events have intervened a bit. We're now in the middle of the COVID crisis, and it's, as I understand, and I'm sorry to hear, it hit very close to home for you.
Yeah, I was traveling in March 12th, around there, and when I was traveling, I realized through some friends that I think I was exposed, and then they tested positive shortly thereafter. So, and I started developing symptoms. I came home that Sunday, and on Monday, I was developing symptoms, and luckily was able to get a test scheduled in San Mateo. Did the test. Symptoms were worse when I took the test, and then it took 9 days to get the results back. Wow. And during that period of time, it was pretty stressful because A, not knowing entirely if I have it, B, as you know, the symptoms that are reported from people vary. And so the hard part is every morning waking up and thinking, is it going to hit your lungs or not? And I'm one of the fortunate people where it didn't hit my lungs. And I was recovering. But through that process also, my wife ended up getting it.
Oh, no.
And my 18-year-old daughter ended up, I think, getting it. My wife tested positive. She's a hospitalist, a physician. And so that even made the situation more emotionally challenging. But luckily, all of them have recovered, and including myself. That's there. And, you know, we ended up making lemonade out of the lemons. Because I just launched yesterday a nonprofit initiative based on my experience. I'm happy to tell you about that.
Yeah, I'd love to hear about how that's going, and I'm glad you're all doing better for sure.
Yeah, thank you. So, as my wife Lydia and I were going through the recovery, a lot of Silicon Valley friends reached out that were helping the state, and in general just wanted to get immunology testing working. So this is about seeing if you have antibodies.
Right.
So could you be safe to go work around, to go back into society? Could you be immune? And it's especially important for someone like my wife who could go into a hospital and not worry about PPE or anything like that, or getting infected. So we got a bunch of tests lifted to us from friends that they had got from China and other parts of the world that they were just testing. And they worked with UCSF on this test as well. And what we found was that 2 out of the 3 tests didn't even work. And their way of finding me was very haphazard, and only because I put my hand up on my big social networks. And if I hadn't, they wouldn't have known. And what I also so I dug into this space of, okay, we are innovating fast on testing. We're innovating fast on treatments like plasma, convalescent plasma. And of course, there's a lot of innovation around the vaccine itself. All of those things at some point in time require patients to do clinical trials. So I wanted to see if that was a bottleneck, and I dug into the industry more, and I found some shocking things. 85% of clinical trials are delayed due to patient recruitment, because it's very specific what they need, how they need it, when they need it, et cetera. And especially something like COVID, like they need you in this particular window after you got it. The other thing is that of those consumers, and you being a consumer person could understand this, there's a lot of friction that the healthcare industry has put onto these things. Right. And so 65% of people that actually want to don't end up completing the process. And so I was like, oh my God, this is an interesting business problem, but this is a urgent problem to solve the pandemic. And if vaccine or testing or one of these developments are the bottleneck, which I think they are in some cases, then we could actually, by compressing patient recruitment, we could actually compress the impact of the pandemic on the economy. So it's a huge problem. Right. So I put a note out to friends on Facebook, including you, Kent, and someone responded that before you make something like this, go look at a company called Clara Health, and they're backed by Coastline Foundation. And I talked to the CEO, he's a wonderkind. He took college courses at 11. He
Yeah, that guy.
graduated Berkeley at 16. One
Yeah.
of those people. And he I think, partnered with a Teal Fellow. And they created a broad-based registry, which takes someone with any patient conditions and matches them to all the clinical trials that are going on. And not only do they do that, but they actually get the person, they handhold the person through the process, because that's where you lose them. It's not just online.
Right.
And so they've been able to accelerate 200 to 400%. So I said, hey, Evan, why don't you take a version of your service that is only COVID-19 trials and make it entirely free, because we have an urgent need for this as a community. And he and his investors agreed, which is awesome.
That's great.
Two weeks later, which is yesterday, we launched worldwithoutcovid.org. And what it is a registry for anyone, whether you're COVID positive, negative, or you've not been tested. Come on, fill out a quick screener, very consumer friendly, takes 2 minutes. And we will start sending you trials as well as plasma donation opportunities if it's relevant, so that every single person can actually make a difference in the speed of solving the pandemic. And so we got some good coverage yesterday, and we're trying to get hundreds of thousands of users. One example is that we have now 470 trials that are related to COVID on the site as of launch. And we looked at how many volunteers do they need in total. They need 270,000 volunteers. Now, the United States only has 500,000 people tested positive for it, roughly. So we need more than half the country to sign up to volunteer on these research trials, which is unprecedented.
Right.
If you look at observational trials where they don't give you a medicine, but they just want to observe you for therapeutic reasons, they need 15 million people right now in those trials. Then that's global. So I'm excited that I could utilize some of my Silicon Valley contacts and just be a producer of this.
That's amazing. Are these trials, are they, is it that we find people have it for tracking, or is it to create a vaccine, or is it this sort of serum thing where, obviously not, this is not how it medically works, but I can somehow take some of your blood and get the antibodies from you?
So the first priority is clinical research trials, which involve, they could be new testing tech, like do the blood prick and do it at home versus have to go in and get the phlebotomist to take blood into a lab. So it could be that. It also could be treatments like there's a treatment called interferon lambda that Stanford's testing, which they believe if a person who's COVID positive takes it, the shedding, the virality of the virus goes down dramatically. So that could lower the spread. And then there's vaccine treatments. And then there's plasma, convalescent plasma. John Hopkins is doing a massive study where they're giving convalescent plasma from people like me that are recovered COVID positive to people that are in critical care, and seeing if it makes a difference and what are the side effects on doing it. So all of the above. When it comes to contact tracing, which is something that Silicon Valley is focused on right now, and Apple and Google announced, we can certainly, they're going to need people to test too. And we can certainly do that. But I would say that that's a bit easier because you just need people to download an app in doing it.
What is your sense, having had this, if you didn't know what it was, how did it feel to you? Were you like, this is something different than being sick before, or would you just have let it pass?
And I think it has impacted people in different ways. There are some people in the tech community that have died at a young age. So my experience with it is that it felt like a mild flu, but then had weird symptoms that I've never experienced. So the weird symptom was a loss of taste and smell. Another weird symptom was being extremely fatigued, but not nailing it to a particular ache. Like when I had the flu in the past, you're all achy, your muscles. This one was like, I felt kind of normal, except when I tried to walk up the stairs, I was like, whoa, that was hard.
Interesting.
In doing it. And then also I get over the flu usually in a couple of days. I'm a pretty healthy person. And this took 20 days to get out of the system. And there was a persistent kind of headache in the back of my head, which was again, mild compared to the lung issues that people have. But when you try to lie down and sleep, you could just feel it the whole time.
Well, so glad you guys are all doing better now.
Yeah.
What is your sense of how this, I've talked to a lot of people who are like, I had this really, some of them coming back from China, but being in the Bay Area where most of the China flights came, a lot of people are like, I had this really bad flu back in January, February. I wonder, and of course, given the state of testing, they're wondering, not knowing. Do you think this kind of went through a lot of us at some point, or?
Yeah, I do think so. And I think that with this antibody testing, I think we're going to start to get some answers on actually how many people were infected.
Yeah.
Because if you got it, I'm sure you've talked to friends who said, yeah, I felt kind of really weird
Yeah.
flu back in early February or late January. And I absolutely believe that it did hit through people, but it just wasn't in the press. So you just felt you had the flu, or you
Yeah.
were just sick. You're down for 5 days.
So what is your sense? I think we probably both know Gavin Newsom a little bit, the governor of
Yeah.
California here, who kind of locked everyone down early. What's your sense of kind of the state of how that's all going? It was a kind of a 2-week lockdown, and incredibly, I guess I should have more faith in people. It seems like everyone in San Francisco, at least, did it. Like they're inside, the streets are empty, boarded up, and then it was like another 4 weeks, and I'm kind of getting this feeling of like, well, the idea was that you get 2 or 6 weeks to kind of figure something out, not that this thing works and we just keep doing it forever. What is your sort of sense on the interplay between the disease and, sort of just like the health effects that are going to start coming from the other side of the equation?
So there's a couple of reasons to do a lockdown, and you have to look at kind of the most critical reason of doing it. There are two really, really critical reasons that a lockdown should happen. One is that you will overwhelm the healthcare system
Right.
because of the amplitude of that curve and in such a short period of time happening. And this is the concept of flattening the curve. It doesn't mean that there'll be less cases, but it means that you'll be spreading them out more. The second is that you need to immediately secure people that are extremely vulnerable. So people that have existing conditions or older people, and doing a lockdown means the probability of someone infecting them is lower because everyone is locked down. And I would say, taking the second one first, you then need to have a system in place that can consistently protect those severe cases. And Gavin Newsom mentioned this last night, of the 6 criteria that it would take to reopen California.
Right.
We don't have that done yet, but I think that is actually a solvable problem. And so we've done a good job in avoiding that to some extent. Still, people have died. On the first piece, which is flatten the curve, absolutely it's worked. And if you look at, there's online statistics that show the number of beds in ICU and ventilators, and we are way below the danger zone in California.
Right.
And that wasn't the case in other parts of the country that are there. So, and that was a matter of a week. And if you look at a lot of our friends in Silicon Valley that understand virality, they'll look at something, and you were involved in this early on, virality. Yeah. If you make an action now, it has humongous impacts down the road in terms of the tail end effect that are
Right.
there. And that's what we're seeing. So I think net it worked, but I think you have to get the right processes in place, the protections, and also the big piece that's missing is testing. Since the lockdown started, we haven't really improved the testing that much in California. And so I don't think you're going to stop this shelter in place until you get some of those things solved.
Right. And do you think we're on track to do that, or what's the?
I think we were slow, and I think there's more movement around testing, but it is basically California and all the states on their own.
Yep.
What I don't feel like we're on track is any sort of real coordinated federal response.
Yeah. That seems pretty lacking. Well, let's not even wait till the end of this thing. Like, who should go to where to support what you're doing?
So I think whether you're COVID positive, negative tested, or you're symptomatic or asymptomatic, just go to worldwithoutcovid.org, and if you want to volunteer to compress this pandemic, that's all you need to do. And then over time, we'll be hitting you up to see how your status changed. So if you haven't had a test, we'll hit you up to when your test happens. And this is entirely volunteer and consumer opt-in. Right. There are pockets of information all over the world of who took tests where, but it's really hard to get at those, and especially with HIPAA rules. And so this is an attempt to just get consumers to go direct and raise their hand.
Okay, that's fantastic. You mentioned the federal response. Probably not. Probably shouldn't hold our breath that the current president's going to get this all figured out. You were a pretty big supporter of Mike Bloomberg, and then very quickly Joe Biden.
Yeah.
That field has kind of shaped up. How do you kind of assess? You've taken that path from Bloomberg, which made a lot of sense, and he did the right thing and supported Biden. Do you think, supposing you agree that we would like somebody different to be handling this crisis, do you think Biden's kind of set up for success now, given how everyone's sort of fallen in place? Or
I think Biden is set up for success in terms of endorsements. Just this morning, Warren also handed the official endorsement. So there's no one left. And of course, Obama was waiting to see who wins, because he wants to make sure he supports the Democratic Party. So endorsements, we're doing great. I think where we're not doing great is getting him out there, because he can't be out there.
What is the...
Well, I talked to the campaign because I'm involved, and I said, my perspective and my friend's perspective in Silicon Valley is that we don't really see him even on some of the more common media outlets.
Yeah, like he doesn't show up on CNN.
Yeah, and they sent me a long list of all the places he is showing up. So I think there's a little bit of, is he showing up in the right places is a question mark. And I think he needs to improve that. And then I think just in general, I think that he would do really well at live events. And that's just unfortunately not an option right now.
Yeah.
So I think what you have is an incumbent president with a megaphone who frankly can twist any story into his direction.
Yep.
And you have someone who barely has a megaphone, and is maybe partly due to his campaign, partly due to the circumstances of the event, make it a really difficult campaign to run.
Yeah.
And then you have things like voter suppression in Wisconsin, that are happening. So I'm worried about the campaign because it's just so unprecedented.
Yeah.
I'm not worried about the candidate. Every candidate has their flaws. People could say he's, is he not as eloquent? And he had actually a stuttering issue growing up. So it's not about senility, as people like to say. It's more about just he has a different style, and this is just how he speaks. But I'm confident that the people can get behind him if they can just get in front of them.
Right. And I think, the people who I talk to are like, look, even if you don't love him, and this was kind of the same thing with Hillary Clinton, I don't know why you wouldn't, but they're like, just think about the team a guy like him would assemble. Like just on any given topic, think about, even if he didn't do anything and just put in place a team and went and played golf for 4 years, it would probably be a dramatically better situation.
Yeah. And I think that, I grew up in Pennsylvania, in the Rust Belt, in Bethlehem, Pennsylvania. And a fair number of my friends and even family voted for Trump.
Yeah.
And when I talk to them about their views, it's not that they're in love with Trump. There are certain percentages of the population that is. But what they felt like is that they wanted someone who can kind of speak at their level. And someone who they had faith at the time was going to help their plight. And that could really speak for them and look up to them, and someone that understood business, not just understanding Washington. And so I think a lot of those traits that they're looking for, Biden is more able to deliver. He's a moderate, and he can appeal to that. He's not trying to do extreme liberal policies. And so I think if we can get the voice out and the Trump voice doesn't spread a lot of fake news and disinformation, that those people that are swing, which are critical to this election, would come the direction. I'm just worried about the execution of that strategy.
Yep. We have a little time to ask you about Lyft. And I guess I want to start with, you moved from a really, really great job, which is being a venture capitalist in Silicon Valley, to going to work for a company. What is it that is so important that drove you to to make that move? There must be something beyond this is just a good job.
Yeah, I've gone from entrepreneur, to VC to entrepreneur to now big company executive. And I think the consistent theme was looking for a creative challenge that I think could have impact. And since 2006, the theme for me has been climate change. And I believe that it is, setting aside our current pandemic, which is a huge issue, but it is going to go away.
Yep.
Climate change doesn't go away. And in fact, now more than ever, I'm worried about the fact that there will be lots of trade-offs made in the name of the economy in sacrifice of climate change when we maybe have 5 to 7 years to make a huge difference.
Right.
So I made that shift because I thought that the investor one was fun, and it ended up being lucrative from a returns perspective for Mayfield. But I really thought I could have more impact on climate change at a place like Lyft. And specifically the commitment that the founders made when I invested in 2010, because I led the Series A. And I knew how committed they were to electrification of transportation, which is a key point. And so I felt like I could probably make change faster than there. There's a lot of capable VCs that are going after the investment world, and could I make more change there? So to me, it's less so about the role, and it's more about where can I optimize impact.
And so what is the climate change aspect to Lyft? Is it that just the cars are like, what could we all just get electric cars and drive them ourselves? Like, what is the component of Lyft that?
Yeah, so I think it's,
that?
And we're going after a couple societal benefits. So climate change is one. The other is congestion, which means reducing the number of cars. So just changing to electric cars doesn't solve that. And the other is, which both is electrification and reducing congestion, is around micromobility, which is the bikes and the scooters. And we have aggressively integrated transit. This is something that I worked on early on when I came to Lyft, is looking at the transit opportunity, and now we're going after it. And so the simple goal is to reduce car ownership, and for those vehicles that are on the road, to electrify the fleet. Now, why are we in a better position to do that than you and everyone else buying Teslas?
Right.
Because right now, for the average person, the upfront cost of an electric car is still too high. It doesn't make economic sense. And those incentives that existed are getting less and less over time from the government. And so from our perspective, especially in the cases where we're owning a fleet, like let's say in the self-driving world, these electric cars can last 3 to 5 times as long as a combustion engine car. And our business is all about the cost per mile. We're utilizing cars 80% of the time. The average consumer only uses their car 4 to 5% of the time.
Right.
So we are less sensitive to the upfront cost and more sensitive to the operating cost, whereas the consumer is more sensitive to the upfront cost. And that's the economic reason why I think we can make this happen. Two, is that there is range anxiety and charging anxiety for consumers.
Right.
In our case, we know exactly where to put the chargers. We have all the data. And when we're operating a fleet, we brought the person who ran the supercharger network at Tesla. He's now doing all of our fleet infrastructure, including charging. And so we can build out a charging network that can be highly utilized just by our cars.
Right. Oh, that's fascinating. And what do you think the impact will be as the cars become autonomous, et cetera, on urbanization? Are you making urban life better? Or are you making it more appealing not to be in an urban center because you can sit in a remote vehicle for an hour and a half and you don't care?
Ultimately, I can't tell you I have the answer to that, because you could see it going different ways. But I am hopeful that the benefits that exist around density and living near your neighbors and community, and reclaiming time, because even if you live far out and it's an autonomous car, it's still time away from the things that you want to do outside of a vehicle. I think ultimately those factors are going to outweigh the fact that you can watch a movie or do your work in a car.
Yeah. How is Lyft weathering, or how has this impacted? I mean, obviously Airbnb's been hit pretty hard. Has the COVID thing, how has it affected Lyft?
So I'd say first, we're lucky to be deemed an essential service by, I think, almost every city, if not every city in the country. So we're operating and we're in business.
Right.
certainly ride volume is down because of shelter in place, without a doubt. It's impacted our business in a big way because people are not moving around the city as much. And so we are, though, I think being really helpful in cities around getting the right supplies, whether it's medical supplies, getting food to seniors. We just announced a very big healthcare initiative where we're going to be transporting healthcare workers back and forth as well. So there are parts for us to play as we're going through the worst parts of this pandemic, which we are right now. Yeah. There will be a recovery. It will come back to normal, but we're going to have a renewed emphasis and a different emphasis around safety. Around the driver, making sure they won't get sick or they won't get another person sick. And similarly on the passenger, and them feeling comfortable going to a situation where someone else maybe was in the car right before them. Yeah. So we are looking at lots of solutions there to make ride sharing as safe as possible. But we think that it will be also important to be there because as the recession hits and gets deeper, the ability for a consumer to buy a car is also hurt. And the total cost of ownership of a car is large especially if you're just using it 5% of the time. It's a luxury item. Right. And so we do think that factor cost is going to drive people, but we're going to have to also do our part in convincing the public that it's safe. Yeah.
Well, let me finish with this. This was kind of a fun one. You're in a band. You're in Cover Flow. Is that right?
Yes, that's the night job. That doesn't pay well.
Performer in a band. What in the heck is going to happen to those people? Like, what is happening to like musicians who go to, where the live show, putting a bunch of people in a single space is how they exist?
Yeah, it's a really good question. And I was thinking about this. What we're seeing is a quick transition for fitness trainers to go online. And it's not the same payout, but you also don't have any limitation on the number of users that are there. So, for those that have been involved in the music world, and I was investing in it back when I was a VC, we always dreamed of the time where you can dramatically lower ticket prices, but dramatically increase the attendance because it's virtual. And so I think there will be something there. Now, will that make up for the lost revenue of actual physical large-scale venues? Probably not in doing it. The other is to go to the other extreme, which I could see, which is to have very, very high-end VIP shows that have very, very small audiences or extremely socially distanced audiences where you have marks on the floor that you're hanging out and listening to music. And I think you're going to see a combination of all that over the next 18 to 24 months because until the the vaccine is not just created, but administered, we're not out of the woods.
Right. Wow. Well, it's quite a world we're living in, but we're glad you're feeling better and glad that you are doing better and glad that you've tried to do something to solve this thing. So let's remind everyone one more time, like where they should go to help support you.
Yeah, I would say to support ending the pandemic as fast as possible and to support lowering the amount of people that are either dying from this or getting severely impacted. It's about compressing research. And to do that, it's for you to volunteer. Whether you're positive, negative, or any other, or not tested yet, go to worldwithoutcovid.org.
Great.
On the World Wide Web.
Yeah. Yes. Don't show up at their office.
Yes.
All right. Well, thank you so much for doing this.
All right. Take care. Thanks, Kent, and be safe and be healthy.
Thanks a lot. All right. This has been the Something About Your podcast. Raj Kapoor, my guest. Talk to you next time.